What do you think explains it, though? I mean, why did we get doctors like Jay Bhattacharya, of the Great Barrington Declaration, and Dr. Marty McCary at Johns Hopkins, and you, and these really well-educated, well-credentialed, sane doctors who can see very clearly what works and what doesn't, and they're not afraid to challenge the establishment line like a Dr. Fauci edict. But then we have so many in the medical establishment not only attacking doctors like you for speaking out, but totally going along with and towing the line on lies we've been told. Like, yes, the little cloth mask is going to do something for you.
Yeah, until Omicron came around, then it stopped working suddenly. Mm-hmm. Megyn, I think I ponder the same question, and I think there's more happening than I can imagine, but at least one component of it is, I think, sort of buy-in politically, sort of people having difficulties separating their ideals or political ideals and perspectives from science and what science was saying. So I think that's at least part of it, where there was such a desire to believe that, we're all in it together. And, if we all just, coordinate our behavior and do certain things, it'll work. And I think that just kind of got sort of wrapped up with, what tends to be sort of a liberal perspective on life and politics, in medicine and in science in general. And I think, some people are recovering, some people still haven't recovered. But that's a component of it. But, obviously there was a Trump factor too.
I feel like certainly into the rise of Anthony Fauci as sort of this non-Trump, this other than Trump sort of leader. But I do feel like there's been a collapse of trust in public health officials and bodies as a result of this. Like no one's looking at the CDC or Anthony Fauci's group the same, and probably never will until new leaders are in there and there's been a complete ownership of what they've done to us.
You're absolutely correct, Megyn. Jay is a good friend of mine. Jay is a very good friend of mine. I knew him before the pandemic, and we got closer during the pandemic. And we've talked about what you just said also. And it's they've really just completely sold their credibility. I mean, some of these studies. I don't know if you know Dr. Vinay Prasad, but he's great at UCSF. But he had a great piece like a week ago about how the CDC has just, sort of systematically misrepresented data to achieve an objective that was political. And you want to throw up when you see this stuff. It's so gross.
The Rochelle Walensky almost, it's like a robotic thing on the, yes, you must mask, the mask must stay on, the mask may not come off, the unwillingness to answer for the flaws in the so-called studies and surveys that she's been touting, right? It's like, we know those studies don't hold up. We know they're not worth the paper they're printed on. And now she won't even speak to the mistakes she's made, to the errors lies she's told about. Oh, no, that study out of Arizona, that proves that masks provide 3 times the protection that you get when you don't have a mask on. What do you make of her?
So I trained at Harvard, and she was there when I was there. She was senior to me while I was a graduate student. She was part of the PhD program and the piece because she did because she did a lot of HIV modeling. And I was also doing mathematical modeling in the PhD program. So I was familiar with her work before. I've never met her personally. I have, no idea what makes her tick or what her motives are. I really have no idea. But it's been dastardly, the dishonesty and the scientific dishonesty that we've seen out of the CDC. Mm-hmm. Everyone knows, for example, particularly with this mask obsession, everyone knows that in general, randomized clinical trials provide the highest quality evidence. So you have randomized clinical trials that basically show either no benefit of masking or this much benefit of masking. I mean, very little. And then, they put out studies that show like a 70% reduction. I mean, give me a break. It's laughable and it's sad.
It's a joke. And not only that, I mean, I'm sorry to get personal, but what's with like the crying and I feel a sense of doom? I mean, you're a public health leader. What kind of behavior is that?
Yeah, I know. And this is another piece, right, Megyn? This fear that has been like literally, you study public health, like chapter 1 is that fear and coercion are not tools that are part of public health.
Oh wow! I didn't know that. They really are violating the playbook.
Yeah, this is, it's like, and now we see why, right? Like, mistrust, right? Conflict. We're reaping the products of those tools, and then of course just a burden. So you've still got young people who are afraid of contracting a virus that they probably have already contracted and recovered from. Mm. You've got people who've received 3 vaccines and still are afraid to go outside and eat at a restaurant. And I witnessed it firsthand with the young residents on my team when I was first working in the hospital with COVID patients who, you look at the data and it's right there in front of you. You're young, your risk is extremely low, but they're terrified. It's just the whole approach, this use of fear as a tool has just been a complete catastrophe and so harmful, and will continue to be harmful for a while. Yeah,
because we do need to trust them. That's the scary thing. It's like, it's not just like breaking up with an ex-boyfriend. You say, oh, okay, I learned something about him, I'm moving on. We need to trust them. There'll be other situations in which their input is important, and just the overall undermining of messaging from our leaders. I mean, it's deeply troubling on a number of levels. Hey, thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.